MBBS, MS ENT. I am a practicing ENT surgeon in this hospital for last 20 years or so. Common causes of hearing loss is either infection or aging process. For infections, we are doing all kind of surgeries, including tympanoplasties and all that. And for aging process, hearing loss, one has to use a hearing aid. You cannot control that wax basically because it is produced inside your ear canal. You can just use some ear drops and you can get your ear washed up. That's the only solution. You cannot cut it. Always due to the infection, one can have a rhaphatalgia. The pain you can have pain in your throat, which can go to your ear, or you can have pain in the tooth, which can also go into the ear. And there are so many other organs from where you can get pain in your ear. At times, one can do without medication. Also, one can have some steam inhalations and gargles and can get better without medication also. Sinusitis can be infective or allergic. In cases of allergic sinusitis, one has to avoid those allergens which causes basically sinusitis, something like exposure to dust, which is the commonest cause, or some kind of pollen allergy and all that basically. Infective sinusitis, one can have infection anytime, anywhere. For that you have to take medication or washes and whatever it is required, you can go ahead and can get it done. That's that nasal bone. We have a septum which is dividing our nasal cavity into two halves. It is always, most of the time it is in the midline. At times it can deviate to either left or the right side. The cause may be during childbirth, it can happen, or it can happen because of some kind of injury. If one is having a nasal septum, deviated nasal septum, it is to be corrected. One should avoid allergens, dust, smoke, all those kind of stuff. The rest you can have some kind of long-term anti-allergics and all that. That can prevent your, basically prevention means one can just avoid the things which provokes these kind of condition basically. Conscious about their problems. So they are bringing new cases, cancer cases have become quite common. They must have been common in the past also, but awareness is more, so we are able to take more cases. One cannot give a blanket kind of thing, basically you stop this and stop that. That depends upon the problem, for what problem we are taking those prevention measures.